One of the most frustrating and dangerous things that I see in my practice is how many people hesitate to take medications for high blood pressure just because they feel fine. They feel fine, so they think that treatment can wait. But here's the reality. Hypertension is called the silent killer for a reason. It damages your blood vessels quietly and over time, raising your risk of heart attacks, strokes, kidney failure, and even dementia. And the key is that timing matters. Now we have a solid new data showing just how much timing matters. But first, welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and an IFM-certified functional medicine physician. On this channel, I share health tips on skin health, food and supplements, functional medicine, surgery, and the latest medical research to help you feel your best. And if that sounds good, please like, share with your friends, and subscribe. Let's talk about this new study that was published in a journal appropriately called Hypertension. So in that study, the researchers looked at over 15,000 adults with newly diagnosed untreated high blood pressure. The average blood pressure was 153/90, and that's significant. The average age was just 56. These patients had never been on any blood pressure medications prior to the study. Researchers found that those who started treatment within the first months of diagnosis were significantly more likely to get their blood pressure under control, not just at 6 months, but even 2.5 years later. Let's look at these key findings. So only 44% of people started treatment in the first months after diagnosis. Those early starters had 57% control rate of their hypertension at 6 months compared to 47% for those who delayed. At 30 months, that difference persisted. At those who acted early, they were 21% more likely to reach their goal blood pressure, even with stricter targets like under 130/80. What does it mean? Delaying treatment could set you up for years of poorly controlled blood pressure with all the risks that come with it. I also want to comment on the medical treatment of high blood pressure from the functional medicine standpoint. As we always say in functional medicine, we aim to treat the root cause. And in the case of high blood pressure, the root cause may be inflammation, insulin resistance, stress, or poor sleep, and many other things. But that doesn't mean that we ignore early intervention. You can still optimize diet, reduce toxic load, reduce your stress, support your vascular health while starting safe, appropriate medication if your numbers are high. Medications are not your enemy in this case. Waiting too long, maybe. And once all of these lifestyle changes that you have implemented start producing results, then you may not need to take the medication anymore. For example, losing weight in most cases improves hypertension, leading to decreased dosages of meds, or in some cases, the medications become redundant. But before that happens, please don't wait to treat your high blood pressure. And always, always consult your doctor before stopping any prescribed medications. So in summary, if you or someone you love has been recently diagnosed with hypertension, don't wait. This study just proves that taking action early can change your health trajectory. Control it early, protect your brain, protect your heart, and your future. If you enjoyed this video, please subscribe for more insights on how functional and conventional medicine can work together for better health. Thank you so much for watching. Until next time, bye-bye.